We're going to move on to some prepared questions. We'll have each speaker speak for 2 minutes, and then they'll each be able to have a rebuttal, 1 minute each. Mr. Hutchinson, you'll be able to answer first. This summer, a global commission of former world leaders and activists put out a report calling for the U.S. to drastically shift its drug policy away from incarceration, citing that the current system of locking up users and abusers isn't curbing drug abuse and is ultimately not an effective measure to take against the problems associated with drugs in society. Do you think this commission is right in their conclusions, or are they misled and don't fully understand the effectiveness of the war on drugs in the United States? 2 minutes.
Well, the Global Commission report, which I have read, is a report that basically adopts the European model of harm reduction. And it advocates that for everywhere. Did it properly evaluate what's happening in the United States? No, I do not think so. For example, the report talked about an increase of global drug consumption. In fact, cocaine, according to the report, had increased globally by 27%. Well, during that same time period, cocaine use in the United States declined, dramatically declined. And whenever you look at other drug use, they've all declined except for marijuana use in the last 2 years. All of them have declined since the 70s and even declined even the last couple of years except for marijuana use. So I don't think it fairly treats what's happened in the United States. Secondly, and this is really part of your question, is our incarceration rates. Well, the fact is, if you look at our federal prisons, less than 2%, I think that's 190, less than 2% of all federal prisoners in the United States are in custody for simple possession. And usually that's because it started with a trafficking case and they pled it out so they accepted a simple possession. But less than 2% are incarcerated for simple possession. The idea that the federal government of the United States is incarcerating simple users is a myth that has been perpetuated by those that simply want to legalize drugs. And the fact is, we don't. And so, yes, I think the Commission report does not recognize some of the things that happen in the United States. For example, the Commission report does not talk about drug treatment courts. How many of you are familiar with drug treatment courts? Drug treatment courts are alternatives for someone who has an addiction problem, so they don't go to jail, but they go to a treatment facility with accountability. And it's been a very successful program. And so many states, including Arkansas, including myself as a person, has advocated for expansion of drug treatment courts. That's not addressed in it. The crack powder cocaine reform legislation was not addressed. So the progress was not addressed in it, and I think it is misleading.
Okay, well, I was actually honored to be able to serve as an advisor to that global commission. And this wasn't just any global commission. This included 3 of the most distinguished former presidents, not leftist presidents, but center-right presidents from Brazil, Mexico, and Colombia. It included Kofi Annan, the former Secretary General of the United Nations. It included Paul Volcker, the former Chairman of the Federal Reserve Board. It included George Shultz, the former Republican Secretary of Everything, right? Included Richard Branson, many, many distinguished people. And I'll tell you this. What they basically said, and this goes to Asa's point about, well, is it either legalized or war on drugs, and there's not all that much in between, except maybe drug courts. What I would say is what the commission said, and what I would also agree with is, when it comes to drug policy, as with most other areas of public policy, you're talking about policies arrayed along a spectrum. From the most punitive, lock them up, cut off their heads, drug test everybody policies of Singapore or Malaysia or maybe parts of the United States, to, on the other hand, the most libertarian free market policies like, say, the way cigarettes were treated 40 years ago in America. And that there's a whole series of steps along this way. Now, what I'm advocating for, Asa, is to let's move things down this direction. Let's reduce the role of criminalization and the criminal justice system in drug control policy to the maximum extent consistent with public safety and health. We don't need to be putting the criminal justice system, the cops and the prosecutors front and center. We don't need a drug czar who has to be either a former police chief or military general or professional moralist. How about somebody from a public health or a medical background? When it comes to marijuana, yes, Let's make it legal. Let's tax, control, and regulate it the way we do, say, with hard liquor. Are there risks associated with that in terms of more people using marijuana? Yes, of course. But when you look at the FBI statistics that came out a couple days ago saying that half of all the drug arrests in America are for marijuana, almost entirely possession, when you look at the crime and violence in Mexico, when you look at the violation of people's civil liberties and right, all this, I say there are risks you got to take to move in the right way.
Well, I'm delighted to know who is behind the Global Commission report. Now that I know that Ethan Nadelmann was an advisor, I understand why they adopted the harm reduction policies of the European nations. And you pointed out Singapore. I think that's one of the problems of taking a global report with Singapore that has a let's cane them type philosophy. Sure, they need to adjust in other parts of the country. Perhaps they should not execute them like they do maybe in China or some particular countries. Obviously, we don't do that in the United States, so comparing what we do with what the Global Commission is recommending is not necessarily the right thing. I'm glad Ethan laid it on the line and he simply said, I am for the legalization of marijuana. But he also acknowledged that that would increase usage in the United States, or at least there's a risk of it, I think is the exact language that you used. But he throws out this scary prospect that we have law enforcement officers out there arresting people for simple possession. Well, it is a true statement that we do arrest for that, but that's where they do not go to prison, they do not go to jail.
Quiet.
More French police and terrorists.
Let me ask you a question here. How many of you in here came in here tonight supporting the legalization of marijuana? All right. I just wanted to, how many of you came in here opposed the legalization of marijuana? As I said once, I'm glad our DEA agents did not lose faith in me as they came here. No, we have some friends here. But clearly you see the burden of proof that is before us today.
Yeah. I think, Asa, one of the problems with your statistics, when you talk about the 2% behind bars for drug possession, is that you're talking specifically about people sent to state prison where drug possession is the principal charge. Federal state prison.
No, federal only.
Federal only. Well, federal only. But look, there are 2.3 million people behind bars in America today. Less than 10% of them are in federal prisons. And in the federal prisons, over half are there for a drug law violation. It used to be 60%. And many of them are simply drug couriers or poor people from Colombia, Mexico, Africa, whatever, who get thrown away for 10, 15 years. When you look at the 750,000 Americans in local jails, a lot of them are people like people in this audience and their friends who are getting thrown away in jails for marijuana charges. And when you look at the 5 million Americans under the supervision of the parole and probation system, they're getting picked up for maybe a joint or a dirty urine, and they're landing up oftentimes in state prison. It's just not being called the drug charge, it's being called whatever they got arrested for in the first place. But I think, you know, the bigger thing, and I think this really highlights our difference, you pointed to 1979 as the worst of all years, right? Why? Because you said more Americans admitted to using illegal drugs that year than ever before, and you're right about that. And you're saying that come the 1990s or today, it was down by 30%. Therefore, we're having great success. And I would say to you, 1979 was probably the best of all years. Not because it was good that so many Americans were using illegal drugs, but most of those who were yuppies snorting a little cocaine, and high school seniors and college kids smoked a little weed, the vast majority of whom did not have a problem. 10, 15 years later, drug use in America had fallen by 30 or 40%. But you want to know something? In 1979, nobody had ever heard of crack cocaine. By 1989, it was a national epidemic. 1979, nobody had heard of drug-related HIV or AIDS, but now we have 250,000 people who've been infected or died because we haven't had the right policies. 1979, we were spending $2 to $3 billion a year on the drug war. Now we're throwing $50 to $100 billion a year down the drain. 1979, 50,000 people behind bars on a drug charge. This year, 500,000.